I'm Farah Duro, and you're listening to the PCOS Revolution podcast. Hello, everyone, and welcome back to the PCOS Revolution podcast. I'm here today with Deborah Beaumont, who's the host of the Boobs Aren't Worth Dying For podcast on iTunes. And she's also a good friend and colleague of mine who's a holistic nurse and functional medicine practitioner in Hawaii. And she also is here today to talk about the effects of stress and anxiety on our bodies, especially as women with PCOS, and what can be done to help with that. Now, not only does she work with women who are suffering with depression and anxiety, but she also works with survivors and patients of breast cancer who are basically supporting them with natural treatment and also working with them after chemotherapy and radiation. So welcome, Deborah. Thanks for being on again.
Oh, thanks for having me.
We actually had Deborah on our original season, and really am so glad to have her back. I think you're going to get so many jewels and knowledge just from listening to Deborah talk. I do every single time. So Deborah, thank you so much. And tell me, what really inspired you to work in this field and work with women?
Well, it's interesting that you ask, because I very specifically became interested in working with women after they had gone through active treatment for breast cancer. I remember I was going through it myself, and I was in a support group. And I remember in one session, there was a group of women. They were all kind of in similar phases of their treatment, and they had all finished in like a 2 or 3 week period of time. And in one group, they were all saying, I thought I was going to feel so much better when treatment was over. And I'm more depressed now than I've been since I was diagnosed. And that was really distressing to them because they expected it to be an uplifting experience. So that was when I tuned into the fact that there's a kind of an emotional and physical response that happens when you're dealing with an illness and you're not in the active phase of treatment. Because in many ways, when you're in active treatment, even though that may not be what you would choose to do, it can be something of a mobilizing experience. But when you're actually dealing with something that's a long-term kind of chronic thing, I think that's when some of the anxiety and depression can come up. And I just think in general, we don't really know as a society how to deal with anxiety and depression very well. And I think there's a lot of stigmas still attached to it. And I think it's getting better, but I think it can be really difficult to be in that place yourself and to admit, like, wow, maybe something's going on here, because it becomes, what are people going to think? Or I should be doing something better, or I shouldn't be feeling this way. And those kind of thoughts actually can make a situation of depression worse.
And I totally agree. And we see it every day where, they've even actually done a study at Columbia University. They actually compared women with PCOS to psychiatric patients. And basically they said, well, what are the similarities there? And how did these women compare with women who are receiving outpatient psychiatric treatment? And, they studied 126 women, and they found statistically significantly higher scores on all the symptoms they evaluated for corresponding to psychological distress, and particularly for anxiety, depression. And, they noticed that the women with PCOS were scoring higher than a general population would. And that's the danger there is, whether it doesn't go treated, and we've seen the effects of that, or if it's treated the wrong way, what the fallout is from that. And I think that, the biggest scenarios they said were causing the most problems were basically the stressors were irregular cycles and also abnormal facial hair growth. Those two things actually were causing a lot of depression, and I think those also predicted anxiety, and the women who reported obesity actually associated more with hostility. So I think that if we don't talk about this, and by the way, what happened was with this study is that more than the women with PCOS had distress levels statistically similar to those of the female psychiatric patients. So we've got to address this, and we're here tonight to actually talk about some alternatives, honestly, and some solutions that you can actually start implementing now. So, what would you say has been the biggest game changer with patients you've seen actually who have PCOS and also women who are undergoing treatment for breast cancer?
Well, I think that the one thing that we always have to keep in mind, and this is for practitioners as well as patients, is that when we talk about stress or depression or anxiety, we experience that as an emotional state. But in reality, that's oftentimes reflective of a physical state. The experience of stress and anxiety causes hormonal changes in our body, which actually can make PCOS and other symptoms worse. So when we're talking about these things, this is just not a matter of willpower and a matter of uh, a mental experience. It's actually a physical experience as well. And I think that even some of the more traditional treatments that people utilize is because there's just really a one-dimensional view of what this is. And particularly when we talk about stress, we have to understand that that is a physical and an emotional experience. And once you're kind of in a cycle, the emotional piece can tag team onto the physical piece, which can just put you in like a vicious downward cycle. So I think it's a matter of just acknowledging, for one thing, that if there is a problem, like, okay, there's a problem, and it doesn't mean that there's anything wrong with you. It just means that you're struggling with something. And it also very well could be a hormonal issue. And I think you deal with that all the time with the patients that you've seen in your practice. And I certainly deal with that with the women that I see in my practice as well.
Right. And if you do have PCOS, over 50% of women, I mean, this is probably an underestimate, but I'd say over 50% of women will have depression at some point with PCOS. So, whether you treat this at the root, which I believe is the true answer, looking, like you said, at the hormones and looking at the phases of the cycle, if there is a cycle at all, and really how to really get to that point and the stressors that are going on in the life, it's really not going to be fixed by a band-aid approach. I really don't think.
Right. And I would like to mention, I also am very aware of the fact that women who are dealing with PCOS, particularly women in their 30s, which is a really large group, you're also dealing with a lot of expectations, a lot of goals that you have. If you have trouble getting pregnant, that could be a loss. You're dealing with fertility issues. And all of that is very important to realize there's a legitimate grief process. If you're trying to have a child or trying to get pregnant and you're not able to do that, there's a legitimate grief process with that. And being depressed and having anxiety about that is a perfectly normal response. Once again, it's not a pathology. It's just sort of the human experience. And I think if you can give yourself some permission to view it that way, that perhaps you don't have to stay in that place of being isolated and feeling like there's no one to talk to, which is certainly going to make any of those problems worse.
Right, exactly. And as far as what you've seen with patients who are on antidepressants, do you see that they are feeling better as far as if they have hormonal imbalances as the underlying issue, or what are you seeing?
Well, that's really interesting because antidepressants have they kind of give them out like candy now, and they give them out for a lot of reasons that it sometimes have nothing to do with mood. Some of my clients who are in breast cancer treatment, they're given antidepressants for neuropathy, and may not particularly help, but it's kind of the only game in town when you talk to some doctors. And the thing I like to explain to people about antidepressants, the most common antidepressants, they're called SSRIs, and that's an acronym for a very long name, serotonin reuptake inhibitors. And it's the most common form of antidepressant that's given out, and that's things like Prozac, Celexa, Zoloft, that class of antidepressants. All of those antidepressants were originally developed to be used short term in what they call situational depression, which I think you could argue what that is. So, they were originally used to be used for a matter of weeks or maybe a couple of months. But what's happened happened in the practice of taking these things is that people are on them sometimes for years. And there's to just put it simply, after a certain period of time, they no longer are doing what they were intended to do. And actually, they become part of the problem, because what it is doing is basically tricking your brain into thinking that you have neurotransmitters in your brain that you don't really have, because the medication is artificially giving that feedback signal to your body. So what happens is that your body is like, okay, well, I don't need to be making this neurotransmitter anymore. And so in the long term, you actually become serotonin deficient because your body doesn't read that it needs to do anything to make serotonin anymore. So that's when people actually become literally dependent on those SSRIs just to not feel bad. It's not necessarily making them feel good, but when they stop taking it, they feel so bad, with an increase in anxiety and an increase in nervousness and an increase in what they call withdrawal symptoms. And it can be a really vicious cycle. So I think what I would just caution people about is that just taking an SSRI antidepressant is not the easy answer you should always turn to, but it's going to be the most frequent thing that you're usually offered. I just think it's good for people to know in the long term that it can become problematic.
Yeah, and some patients are taking metformin actually as an insulin regulator to help with their PCOS symptoms, and inadvertently they're actually feeling better as far as with the depression. So, there's actually a study that showed that when someone does come in with PCOS, and we're actually looking at an insulin resistant type PCOS, working with that, whether it be with inositol, like naturally, or, using metformin, they actually can decrease depression. And so how have you seen like the insulin resistance relating to depression in your experience?
Well, I think that really goes back to just the testament of the fact that having depression and anxiety is often a hormonal and physical process. So when you have high insulin, when people think about hormones, they're usually thinking about estrogen and progesterone, the things that are most common. But insulin's a very powerful hormone in our body that affects every other hormone in our body. It's a metabolic hormone, but it's kind of a master regulator of a lot of other things. So when you're in a PCOS dynamic and you have high insulin and it's affecting your estrogen levels, and you have high levels of circulating estrogen that are not particularly healthy, that are toxic, it's like your body is being flooded with a lot of unnecessary hormones, and it causes every other hormone in your body to fluctuate. And that certainly will account for a lot of the mood variation that people experience. So really the first thing you can do from a natural perspective, there's actually two things. One of them is to really deal with that root cause of what's causing the hormone imbalance, which is usually lifestyle, stress, nutrition, diet, and finding ways to bring your insulin back into normal range normally is the first thing you can do just to feel better. And the other thing is that people don't understand that when you have serotonin imbalance, that often is a problem that you're having in your gut, because most of the serotonin we have is made in our gut. So when you look at nutrition and lifestyle and rebalancing the gut and taking probiotics, taking B vitamins to help with some of the stress factors, you can oftentimes correct that hormone imbalance that is really underlying some of these mood problems. It's not just a mental problem at that point, it's also a physical cycle that people are in.
It's interesting. Yeah. And there's so many, I think there's so many good techniques out there, some mind body techniques also that are helpful with anxiety as well. And you're using them in some of your group programs for women who are recovering from breast cancer, right? And can you tell us a little bit about one that you mentioned to me about just a simple breathing exercise, and maybe take us through it?
Right. Well, it's interesting because stress is one of these things that I think everybody talks about, but, some people joke about it. But stress is a really powerful dynamic in our whole health process. Stress is a physical and an emotional response. We experience stress, but physically that's because our bodies start secreting cortisol and stress hormones, and it becomes a physical experience as well. So one of the first things that you can do is just learn some very simple, easy to implement stress reduction states. And, what they talk about is that when you're in this stress, they call it the fight or flight syndrome, because that's what stress hormones do, is it gears our body to either run for our lives or stand and fight. So it's kind of like being revved up all the time. Well, that's not good for our hormones and our emotions, and that's not good for us in many ways. So it's really a matter of learning techniques to take us from that into what they call a rest and digest, where you're calming down, you're allowing your body to like lower those levels, allow digestion to come back, allow ovulation. It really allows your body to be in a more relaxed, natural state. So one of the things that I often tell people is that it doesn't require that you practice Zen Buddhism in order to learn how to meditate. You don't have to sit down for 45 minutes every morning. I mean, it's great if you do, but that's just not how most people are wired. So one of the things that I like to do is to teach people a breathing technique, and it's called a 4-7-8 technique. So basically it's sitting down, kind of quieting what's going on outside. You don't even have to sit down. I've actually done it in the middle of kind of emergency situations, but it's really bringing your awareness to your breath. And so the first thing you can do is just become aware of your breath. And what you're trying to do is take in a deep breath and relax your belly muscles and all of your rib muscles, and kind of take the breath down deeper into your belly so that you can get those muscles to relax and give your body the message that you're relaxing. So what I tell people to do, and it's interesting that I'm trying to talk through this because I'm in Hawaii with the fog, and we have really horrible air pollution right now. So I'm not in a place where I'm able to breathe very well right now.
Oh no, for you. Get out of there.
But the fog is a stressor for me. So as I'm talking about this, I'm also very aware that my asthma is active today. So this is actually a good thing to do when you're, if you do have asthma, you just do it to the best of your ability.
Yeah.
So the first thing that I would recommend people to do is just become aware of your breath. And so in a breathing exercise, and this can be done in a minute or two, but in a breathing exercise, what you're trying to do is really focus on inhaling through your nose and exhaling through your mouth as slowly as possible. And it's really the exhaling through your mouth part, like through pursed lips, like you're trying to blow a feather as far away from you as possible. That's really what activates the relaxation mechanism in your body. So first, the first thing you want to do is exhale completely through your mouth as much as you can. Then close your mouth and inhale quietly through your nose for a count of 4. So you could just count 1, 2, 3, 4. At that point, you just want to hold your breath for like 7 minutes. Not 7 minutes, I'm sorry, for a count of 7. Sorry about that. For a count of 7. And then do that exhale, purse breathing to a count of 8. So it's breathing in for 4, holding for 7, and breathing out through your mouth for 8. And if you bring that attention to your breath, it's called the 4-7-8. It's a very simple name. And if you do that for a cycle of even 30 seconds to a minute, you can notice tremendous shift in your physiological status. And you can do it as long as you like. You could do it for 5 or 10 minutes if you wanted to.
I love that. That's something, if you're listening to this as you're commuting to your stressful job or somewhere that you're going and sitting in traffic, go ahead and start your breathing exercises. This is so helpful. And I know with my own struggles, I used to get really horrible mood swings and PMS and anxiety. And especially when I had the eternal cycles that seemed like I never had very much cycle regulation until I started acupuncture and herbs. So definitely as a teenager, there might have been 2 months in between where I didn't have a cycle, or 3 months. And sometimes it felt like PMS for like 3 weeks. Probably my mother can attest to this. It was pretty horrible. It probably ruined lots of relationships, but that's okay because I got it under control. And really, that's the part, I think, where a lot of people are confused, because it's not that you feel depression every single day or anxiety every single day. It's like it hits you at a certain point sometimes in your cycle. It definitely could. And so some people will actually use antidepressants like 1 week before their period and that sort of thing if you have a normal cycle. I'm not sure if that works, because and to my understanding, I think it takes like a little while for the antidepressant to actually build in your
Yeah,
system.
it usually takes a couple of weeks, at least 2 to 3
Yeah,
weeks.
so I've
So
seen
I don't
that
see how that would be
technique.
helpful.
I'm not sure how that works. Maybe it's placebo. And then I was reading how antidepressants are only 50% effective as well, once you are taking them regularly. So I'm not sure, what's going on there, but I think we need these techniques and we need to address it where we can bring in some of the mind body approaches along with, Vitex and certain plant based therapies. And we're definitely
Inositol and the B
right,
vitamins.
inositol and chromium, basically stabilizing the blood sugar as well, because we know that a lot of times with PMS-like symptoms, you're going to be craving a lot of things that you shouldn't probably be eating as well. So that's when the
Right.
carb cravings go up and the sugar cravings and chocolate and all those things that we talked about during our emotional eating episode. But
Right,
I
right.
remember. So
But
magnesium.
I would like to say that craving those things, it's very common that you crave those things at night because carbohydrates are calming to the brain. So if you're suffering from anxiety, it is actually a physical process that makes you crave carbohydrates at night because it helps you relax so you can go to sleep. But if you're actually doing things like the breathing exercise and doing other things to bring your stress levels and your stress hormones into a more normal pattern, you may notice that those cravings aren't quite as strong as they had been at night, because what your body is trying to do is saying, "Give me something so I can compensate because we're not dealing well here." So when you use some of
Okay,
these
interesting.
techniques, you can support your body to not be working so hard. Your body, I mean, that's the one thing I've learned as an ICU nurse. Our bodies are incredible mechanisms, and we're always trying to adapt and be in this state of balance. And if we're in a chronic state of imbalance, our bodies will work with that, and it'll work with that until they can't anymore. And that's where you start seeing more chronic illnesses, like more insulin dysregulation and more hormone problems. Your body has been working as hard as it can to support you until it can't. So if you support your body to be in a more balanced place, and it doesn't have to spend all of that energy trying to compensate, then it has more energy to maybe work on the health factors that you're working on, like infertility, perhaps getting pregnant, but your body can't do both of those things at the same time, cannot be in a state of stress and still trying to, get pregnant where it needs to be in a state of relaxation and procreation. It's one or the other. So the more you can learn these very simple techniques, as I said, it's not a matter of sitting down for an hour and meditating, but learning very simple techniques to sort of just have a pop-off valve for some of the stress, the more you're going to see benefit. And the more you do it, the more not only it becomes normal, but like your body is like, oh yeah, that's what I'm supposed to be doing. I'll tell you, I was using one of these breathing exercises for myself for sleeping because I was having problems sleeping. I had problems turning off my brain. And so I had been doing it regularly for a couple months at night when I went to sleep. Well, one of my last hospital nursing jobs, I was in like an emergency situation and everybody's anxiety was pretty much going up. And I could feel that I was getting very anxious. So I just was over in the, doing some charting, and I was over and I was like, okay, so just focus on your breath. And I just started doing this kind of relaxed breathing that I just talked you through. And I remember feeling like in a matter of just like seconds, like, oh, I'm supposed to be relaxed. It was like my body just immediately dropped into that place because I had been doing it. So it was like training myself to be in a relaxed place. But you're not going to experience that like the first 2 or 3 times you do it. It just takes repetition so that your body learns like, oh, I can let go. I don't have to be in that place. So that's why I'm a big fan of doing things that are manageable and, time oriented to a few minutes, because anybody can find 5 minutes to do a breathing exercise. You may feel too stressed in your life to sit down and meditate for 45 minutes.
I love it. Yeah, something that you can do no matter where you are, what age you are, what time of day,
Right.
and it's free.
Well, I'll tell you one of my favorite exercises, because I do tend to be a little too hyper sometimes. One of my favorite exercises is something called a shaking exercise. And I have a particular piece of music that I use when I teach people, but it's not that hard. So basically basically you just get really energizing music and you crank it and you just move your body as much as you can. Dance, shake, move, just get all that tension out of your body. And you do that, do it for a couple songs, 4 or 5 minutes. My favorite is Pink. I love Pink. So I'll just and I just, there's a couple songs that oftentimes reflect my energy. And I just do as much as possible. Then you turn off the music and you just stand still for a couple of minutes. After you've done this for 5 or 6 minutes, just turn everything off and just close your eyes and be really quiet and tune into your body. And your heart's probably racing and you're a little short of breath, but you just turn everything off and get quiet for a couple of minutes. And then this is the magic piece. I use 3 Little Birds. I forget who does that, but it's
Is it Bob Marley?
Bob Marley, yeah.
Okay, yeah.
So after a couple minutes of being quiet, then you turn on Bob Marley and then you just and I love that music because it's just, you can just float and move your body in a really lovely way. And, after all of that stress release, I love to put on the music that says every little thing is going to be all right.
I love that. Oh my God. Yes, that's awesome.
And it's so much fun if you're if you're too wired to sit down and take a breath, because I know what that's like, then work with that. Turn on the most energizing piece of music. Turn on Def Leppard if you have to, and jam out. But don't fail to give yourself that quiet space afterwards so that you can notice the difference.
Guns N' Roses is making a comeback too. There you go. Sweet child of mine. Guns N' Roses.
Oh yeah. Oh my God. I love that one. Yeah. So as I said, Pink is my girl. I go to her all the time. Whenever I have to move some energy, I just crank Pink and, that's my music. So just find what works for you. But it's a really fun way. And think about this, it is a meditation. There are many cultures in this world that use, spinning and dancing in ritualistic practices because it's a form of meditation. Because all meditation means is becoming more aware in your body. So if one form of meditation doesn't work for you, then there's another. They have something called concentrated meditation, which is the breathing. And then this is called expressive meditation, where you can do this by coloring. I used to work with a child life therapist, and she could get any hysterical child in the hospital to calm down by giving them a coloring book. Because if you think about it, if you sit down and color, it brings you into your body and it grounds you and it takes you out of your headspace into something that's not focused on your anxiety. So coloring can be a very meditative experience. So it doesn't have to be anything esoteric. And I know, some of your listeners are probably like, yeah, right. But think about it or try it and see how it goes.
Hence all the adult coloring books now that are out at the grocery store that I see a lot of times,
Exactly. I'm in the middle of a move and my husband was just going through the closet and he's like, why do you have all these children's coloring books? I'm like, wait until you get to the 128 Crayola crayons that I use with them.
Oh, nice. You're never too old to color.
Exactly.
That's it. Well, I feel like this is just so key that we don't really talk about it as much because all the focus is on a lot of times talk therapy, which has its merits too. But I think, if that's what you're doing, it's helping, that's wonderful. But there's so many other ways to address anxiety, depression. And definitely if you're at a severe depression, like we have seen some patients where they are at a risk of suicide, then you've got to get help. And it's not going to be through the breathing or anything like that that's going to do that. It's probably going to be a combined effort of many things with medication, with integrative therapies as well.
And, as you and I often talk about, there are a whole host of natural vitamins that can support you. But, many of my teachers have said, there's no vitamin supplement in the world that is going to get you out of a bad physical process. So it's a combined approach, and there are certainly vitamins and supplements that help. Things like inositol and B vitamins are really good when you're out. Looking at nutrition is a really good process. All of that stuff is going to play a role. But when you're dealing with something as chronic, as entrenched as PCOS or hormone imbalances, it really does take all the approaches that you can get your hands on to address it.
Right. And nothing has to be permanent. I say many times, when someone, you don't have to feel guilty, if that's the approach that you're taking is to be medicated for a certain amount of time, then it's a means to an end to get through something that is a temporary state is what I think of. So,
well, that, as I said, that's what they were developed to do. They were developed to be situational support. And then it became a matter of people. I mean, I talked to a woman recently. She had been on them for 20 years. And I asked her, I was like, well, is it helping? And she said, no, it hasn't been helping for a long time. I just don't know how to get off of them. So I'm not saying that medication is bad. Sometimes it may absolutely be needed, but it's not the answer for everything. And as you said, it's not the answer forever. Take them for a period of time, but start looking at some of these other things so that you can get to that state of balance so you don't need to be on them for years and years and years.
And is that part of what you help women with as far as, and we know that there is depression associated with cancer. What is the end game as far as, yes, there's a goal to eventually wean off of these medications because many women with breast cancer are prescribed antidepressants as well.
Right.
What is that process like?
Well, I think at a certain level, there's probably a little bit of overlap with the women that you work with in your specialty with PCOS. For one thing, the thing that I like to tell my women who come in is like being depressed or having anxiety or having sleep issues after you've gone through a diagnosis and treatment for cancer is not abnormal. It's not a pathology. It is an experience that you've gone through. And sometimes depression is just actually a manifestation of grief. And whether, as I said, whether it's one of your clients who may be dealing with the loss of maybe being able to get pregnant or the loss of being able to reach a health goal, or for my women, a loss of their health. I'm not saying that talking to somebody isn't going to help. It just may not be enough, because it's not a pathology. It's not that something's wrong with you, that you're not feeling like yourself after you've gone through this kind of ordeal. The fact is that there's a new normal. There's a new game in town. You're in a different body. You've gone through surgeries. You've gone through hormone depletion and hormone changes. So to kind of hold yourself to a standard of, well, that's how I was 2 or 3 years ago, and I need to get back there. Well, for one thing, that could be a really not helpful in terms of an expectation. Some of it is just kind of coming to terms with what your new rhythm is or what your new normal is. And for my women, and I would think for your women as well, sometimes when you're having these kind of health challenges, there isn't really a safe place to talk about it. People say, well, why aren't you over this? You're making me uncomfortable. Why don't you just get over it? Well, you're through it already. So what's wrong with you? And for one thing, that's where you start. You need to surround yourself with people who can be sensitive to where you're at and not blame you for not being something that they want you to be. And as we've talked about before, women often are caretakers. So they have often been in a role, maybe throughout their entire lives, where they have put other people's needs before their own. And then you get hit with a serious health challenge. And sometimes physically, but certainly emotionally, maybe you're not in a place where you can take care of everybody else first. Maybe you need to, quote unquote, I hate this term, I don't agree with it, but be a little selfish, and learn to say no to your husband. Tell your husband to cook his own dinner, if you don't have the energy. Tell your children, to order a pizza or do their own load of laundry. Maybe it's a matter of learning to step back and in some very constructive ways, set new limits in your life so that you're not overextended by caretaking other people. Because even if you do that, I would say that most women still are often taking care of other people, oftentimes before themselves.
Amen. Yes. And we will definitely post some of your links as well, some things that we discussed today about all the inositol research and also information about the groups that you have, which I think are so important because it provides that support. And, it's not easy to find, and you can participate from anywhere in the world, correct? I mean, it's online. So that's one of the benefits, I think.
Right, right. So one of the things, so I have a group that I'm starting at the end of July, and it combines functional medicine. So it talks about the nutrition and the biochemistry that we've been talking about. But the thing that I think is really missing is also including some of these very practical self-care things that we can do from quote unquote a mind-body perspective. How to incorporate relaxation, how to support yourself to sleep better at night, how to, there's just a number of exercises that we can do. We can do in the comfort of our own home. We don't have to go pay a professional to do some of these things. I consider it the ultimate of self-care. And I think that that's what's missing sometimes is that people are going to practitioners and your doctor may say, well, you need to reduce your stress. Well, that's a great concept, but if you don't know how to do it, how does that help you when you get home and you're like, okay, what do I do now?
Right.
And so what I'm really focused on in the group is not only helping women understand their bodies and their hormonal issues in a much more empowered way so that they know what questions to ask, they know what to talk to their doctors about, but they have some very practical ways to take care of themselves that don't involve having to go see professionals, to do some of these things. And I think that that's the piece that's missing. So that's what I'm really bringing to this group.
Can anyone participate in this group, or is it mostly for breast cancer patients, or what would you say?
It's geared towards women recovering from breast cancer, but I can tell you if you're a woman that's having hormonal issues going on, there would be a lot of benefit there for you. It is geared towards women recovering from breast cancer, but what they're dealing with are hormone imbalances, the need to look at nutrition, vitamins, looking at their own lab work, and learning these self-care skills. So if any of your listeners are interested, they could just call me and we could talk about it, and we could talk about whether or not it was a fit. I can be reached at radicalhealthrn@gmail.com, and my website is mindbodynutritionrn.com. And if anybody has any questions or would like to figure out how they could learn some of these techniques like we've done here, you can learn it in a matter of minutes. They're certainly free to contact me, and I'll help them as much as I can.
Thank you, Deborah. As always, amazing information, and and good luck on your move from Hawaii, your exodus from the volcano.
Oh my God. I'm for your listeners, I am on the island that had the volcanic eruption. And even though I'm not anywhere near the volcano flow, what it's doing is it's really creating, as the lava is hitting the water, it's creating toxic fumes, and that's kind of permeating island wide. And they call it VOG, and that's what I'm suffering from today. So I know I sound a little bit like I have a frog in my throat, but that's because the air quality is really triggering me personally. So so we're saying aloha to the island for now, and we're actually coming back to the mainland. So
well, definitely be sure to take that NAC supplement for your lungs and get some good cleansing going on when you move to the mainland. So thank you guys so much for listening, and have a wonderful evening and week, and we will catch you next week. Take care, everyone. And that's the end of this episode of the PCOS Revolution podcast. If you've enjoyed the show and want to help me spread the word about how women with PCOS and hormonal imbalances can lead happier, more healthier lives, please head over to iTunes and leave us a review. They really do make a difference. If you'd like to have a question answered on the show or would like to recommend a guest, please go to floridacompletewellness.com/podcast. If you're on social media, you can follow me at facebook.com/FloridaCompleteWellness and twitter.com/FloridaComplete, where I post a lot of interesting research, webinars, and articles on our blog about really getting to the root of hormonal imbalances like PCOS. So it's a great way to stay in touch with the latest developments. Thanks so much for listening, and see you soon.